I got this one. Oh, they're gonna hear me chew it on.
Starting.
Alright, everyone. My name is Kelsey Creel, and I am an RN to BSN program student at the University of Women in Mississippi. And today I'm going to tell y'all about antibiotic use and what you need to know. Today, what you should learn from this experience is how to describe how an antibiotic resistance forms, describe at least 2 ways in which antibiotic stewardship affects healthcare, list 3 facts learned about how to avoid antibiotic resistance, and list the rights of antibiotic use. Each year in the United States, at least 2 million people become infected with bacteria that are resistant to antibiotics, and at least 23,000 people die as a result of these infections. Using antibiotics wisely is the best way to ensure that they work for future bacterial illnesses and prevent unnecessary side effects and resistance. What is antibiotic resistance? Antibiotic resistance is the ability of bacteria to resist the effects of medication previously used to treat them. How does this resistance form? Resistance can form naturally in certain types of bacteria, which is not preventable, or by genetic mutation, or by one species acquiring resistance from another, which can happen by the misuse of antibiotics, which is usually the case of resistance. Antibiotic resistance is increasingly growing in healthcare settings within patients. The CDC and other healthcare organizations are working hard to create programs to help slow the progress of antibiotic resistance and eventually eliminate the problem altogether. But one important factor that will help the process is you. What are antibiotic stewardship programs? Antibiotic stewardship programs are coordinated programs that promote the appropriate use of antimicrobials to improve patient outcomes, reduce microbial resistance, and decrease the spread of infections caused by multi-drug resistant organisms. One of the CDC's most popular programs is Get Smart, Know When Antibiotics Work, and it works to make sure antibiotics are prescribed only when they are needed and used as they should be. According to the CDC website, Get Smart for Healthcare is focused on improving antibiotic use in inpatient healthcare settings, such as acute care facilities, through the implementation of antibiotic stewardship programs designed to ensure that hospitalized patients receive the right antibiotic at the right dose, at the right time, and for the right duration. Antimicrobial stewardship interventions have been proven to improve individual patient outcomes, reduce the overall burden of antibiotic resistance, and save healthcare dollars all around. Inpatient antibiotic stewardship programs have consistently demonstrated annual savings to hospitals and other healthcare facilities of $200,000 to $400,000 per year. They do so by improving patient outcomes and shortening hospital stays, which inevitably helps the patient and the hospital both financially and with better outcomes for both. Antibiotic stewardship programs help provide updates on antibiotic prescribing, resistance, and infectious disease management. Nationally, 48% of all hospitals have stewardship programs, and the goal for the U.S. is for 100% of hospitals to have them by 2020. There are the lighter blue states in this picture only have 7 to 33%, which of course Mississippi is involved in that, so we are behind. The darker blue states have 55 to 77%, which is what we're trying to aim for, to be able to make it all the way to 100%. Get Smart About Antibiotics Week is a national annual observance to raise awareness of antibiotic resistance and the importance of antibiotic use appropriately. You can participate in this week by getting involved on Twitter or Facebook and promoting awareness to others through social media. You can also get yourself involved and test your knowledge of antibiotics with an interactive antibiotic quiz at cdc.gov/getsmart. Mississippi's campaign by the CDC promoting antibiotic resistance awareness is called Antibiotics Aren't Always the Answer, which strives to teach that unnecessary prescriptions for antibiotics create new drug-resistant strains of common diseases, and prescribing antibiotics carefully and using them wisely is the key to preventing the spread of antibiotic-resistant illnesses. The CDC website can provide information on how this campaign is run and provide information on how it is funded statewide. The CDC also lists every campaign by every state and how it is funded and how it's run. This picture is from the CDC website also, and it shows a lot of the illnesses that are caused by certain things in Mississippi and how big the prevalence is. C. diff is one of the illnesses that is usually caused by antibiotic usage that is not used in the right way, like not taking your whole dose or not using it when you're supposed to. You can look up some of the sides of C. diff because they're not pleasant at all. Providing education to everyone involved is a major key in being involved in these programs. Ways to educate people include didactic presentation, posters, flyers, and newsletters, which isn't as popular as it used to be. Electronic communication, which is probably the most popular, is more of the social media, Facebook, the internet, emails, and reviewing de-identified cases with providers. What you should know when antibiotics are not needed. Chest colds such as bronchitis are usually not going to be treated by antibiotics, or if they are, they're not correctly treated except in rare occasions. Common colds and runny noses are not something that you're going to need antibiotics for. There's other medications that you could take for that. Ear infections, except in certain cases. The flu, you should never take antibiotics for because the flu is a viral infection, not a bacterial infection, so antibiotics aren't going to do anything for you, or it might just mask the symptoms. Sinus infections that aren't bacterial can't be treated by antibiotics. Antibiotics will not cure a sore throat, and urinary tract infections are not going to be cured by antibiotics, so you do not need them. The CDC website provides a list of alternative options for symptom relief for each of these common illnesses without using medication at all. And you can go down the list on the CDC website and it lists tons of other options that you can use. The antibiotic rights. Right drug. Right patient, because everyone is very different and you can need different drugs, different doses, different durations. You need the right dose and the right duration. All of these rights have to be followed in order for it to be the right antibiotic for you. What can I do to avoid antibiotic-resistant infections? Do not demand an antibiotic when your healthcare provider determines one is not appropriate. A lot of people nowadays go to their doctor and just ask for an antibiotic without even knowing what they have or what they really need. They just want antibiotic because it's what they're used to. Do not take an antibiotic for a viral infection like a cold, the cough, or a flu, because it will create antibodies in your immune system and it won't work the next time you have a bacterial infection you need the antibiotic for. Take an antibiotic exactly as prescribed. Do not skip doses. Finish all of the prescribed antibiotic, even if you are feeling better. So if you start to feel better and you think the medicine's working and you don't need it anymore, you really do still need it and you need to finish out the whole prescription. Do not save any antibiotics for the next time you get sick. Discard any leftover medication once you have completed your prescribed course of treatment. You shouldn't have any to save anyway because you should take your whole prescription. Do not take antibiotics prescribed for someone else. This falls under the right patient category because if it's not prescribed for you then you don't need to be taking it. The antibiotic may not be appropriate for your illness. Taking the wrong medication may delay correct treatment and allow bacterial infection to worsen. Always consult your physician about any prescription drug that you are thinking about taking. Helpful hints on antibiotic uses include keeping up with your vaccinations. Always have a list from your healthcare provider on when you got your vaccinations, when they need to be updated. Try to keep them updated as good as you can. Always use proper hand hygiene early and often. That's one of the most important things I can teach you. Ask your healthcare provider about symptom relief, which is without medication, just trying to treat the symptoms, anything you can do without taking any kind of antibiotics or other things. Only use antibiotics for infection caused by bacteria. Do not take antibiotics for infections that are viral. Be aware if watchful waiting is right for you. And watchful waiting is only right in certain situations. It's not always the correct thing to do. But watchful waiting is pretty much just watching your symptoms and see if they subside on their own, and if you might not even need medication. And your healthcare provider can help determine if watchful waiting is going to be right for you. Ask about all potential side effects from the medication that you're going to be taking, because you need to know if anything's dangerous. Take antibiotics exactly as they are prescribed by your healthcare provider. And always dispose of any leftover antibiotics as you are directed to. The CDC teaches the public that antibiotic resistance is a global issue. In India, 58,000 plus babies died 1 year from super-resistant bacterial infections, which are usually passed on from their mothers. And if their mothers created those resistant bacterial infections by taking antibiotics, then that would be the cause of their baby's death. In the European Union, antibiotic resistance causes 25,000 deaths per year and 2.5 million extra hospital days, which results in more money. In Thailand, antibiotic resistance causes 38,000 plus deaths per year and 3.2 million extra hospital days. In the US, antibiotic resistance causes 23,000 plus deaths per year and more than 2 million illnesses, which also creates a lot of extra hospital days and a lot of money. To fight the global issue, the CDC has formed interventions that include improving laboratory capacity, developing national tracking programs, implementing antibiotic stewardship programs, and expanding infection control programs. The resistance issue does not only involve you, but also healthcare providers. According to the CDC, about 40% of the patients receiving antibiotics receive unnecessary or inappropriate therapy. Healthcare providers play a huge part in antibiotic resistance prevalence by prescribing correctly, which would be only for bacterial infections. They need to pay close attention to dose and duration. They need to be aware of antibiotic resistance patterns in their area. They need to follow up correctly along with changing doses as needed for each of their patients. They need to collaborate with each other and their patients. They need to communicate with patients about appropriate use, include microbiology cultures whenever possible, work with pharmacists when prescribing. They need to use patient and provider resources such as the CDC. All healthcare providers need to stop the spread by following hand hygiene and other infection control measures. They need to get involved in antibiotic stewardship, improve antibiotic use in all facilities by using stewardship interventions and programs with every patient they have. They need to recognize and participate in CDC's Get Smart About Antibiotic Week initiatives. In conclusion, there are many people involved in the antibiotic resistance issue that is progressing, including you. So in order to help the issue, you must be educated about the subject and do your part whenever you are taking antibiotics or anyone around you is taking them. Do we have any questions?